and they're in the lobby waiting to be let in. Ross or Hope, I believe that I disabled the Teams meeting. Is there a way you can follow up on that and I will get started?
Yes.
All right, thank you. In the interest of time, we'll go ahead and get started. But first, I would like to do a land acknowledgement. I'm in West Olympia, the traditional lands of the Coast Salish people, including the people we know today in the Nisqually, Squaxin Island and Confederate tribes of the Chehalis Reservation. I honor their ancestors and leaders who have been stewards of this land and water since time immemorial. I acknowledge their stewardship, their forced removal, and their continued fight to live on their ancestral lands. And this is some quick introductions. My name is Ashley Bell. I use the pronouns she and they. I'm the Behavioral Health Program Coordinator, and I am the lead implementation for 5229, which is the health equity bill that we're doing a listening session for today. And I'll have Hope introduce themselves.
Hi, I am Hope Kilborn, she, her pronouns, and I am the co-policy analyst on this project. It's good to be here.
Thank you. We'll have Roscoe, if he is here.
Yes. Good morning, everyone. My name is Ross Valore. I'm a policy analyst with the Department of Health, and I use he, him pronouns. Thank you.
Thank you. And Dan.
Hi there, my name is Dan Frank, he, him pronouns, and I am grateful to be here. I am a management analyst for the Department of Health.
Okay, and Dan, will you do a quick overview on how to use Zoom?
Absolutely. Today, folks, what we are going to do, we're using Zoom webinar, and so we're going to ask you to use, if you want to share your story, is just use the raised hand feature. And then what we are going to do is we will call on you and we will unmute you and allow you to speak and tell your story. And then after you're done, we will mute you. So it's just about using that raised hands, and then we'll call on you. Thank you so much for being here.
Thank you, Dan. So some moments are to consider. Please be mindful to all of those who attend. Please, as stated before, raise your hand to speak and be aware of the time when speaking. I do have a limit of 3 minutes, but if we do not have a lot of people with their hands raised to speak, I may never put the warning up. So if you go beyond the allotted time, and there are a lot of people who need to go after you, I will have to ask you to finish your thoughts so we can move on. Please stay on the topic of health equity. If you share on other topics, staff may have to stop you or get you back on track. And also, this is a listening session. We will not be drafting the rules surrounding health equity, continuing education at this time, but we really want this opportunity to learn. Also, we do have a voluntary survey. We want to make sure that we have been reaching out to a diverse group of individuals. And if there's a demographic that's missing, we want to make sure we change our tactics so that we can also invite them to the table. Remember, the survey is voluntary, but we would love everyone to complete it if you haven't already. You do not have to answer every question. And just a reminder, it is subject to public records request. So as long as you don't put any identifying information, you will remain anonymous. I will put the link in the chat again for the survey. So real quick, I want to share a little bit on the topic of health equity. And so a lot of people ask, what is health equity? Well, it exists when people are able to reach their full health potential and you're not disadvantaged because of gender, economic reasons, the neighborhood you live in, race, ethnicity, disability status. And so equality and equity are not actually the same. Equality gives everyone the same resources, but equity gives people the resources they need. People are not disadvantaged to be able to achieve their full health potential. So the COVID-19 pandemic has really highlighted inequities in the system. These inequities always existed, but the COVID-19 pandemic has brought it to the forefront. So some people may ask, well, what is this bill and what does it do? Well, engrossed substitute Senate Bill 5229 was passed by Washington State Legislature in 2021. It requires that healthcare professionals take continuing education on health equity. And the goal is really to get people to think about their own impact on others. The hope is that this will change how providers work with others so that they can reduce health inequities. So what do we need? We want to learn about experiences with health inequities. We want to understand how it harms individuals and be aware of its role in the health system. We want to see where the system can transform. And we want to reach groups of individuals that historically we do not hear from. These listening sessions are opportunities for us to hear from you and to integrate what we learn into our rule-making process. This is our last listening session. And so I also want you to reflect on maybe some solutions for also changing the way we work with others. And so with that, I've talked enough. I'll give you the 4 questions. And just as a warning or a notice, some of the information shared today may be troublesome or disturbing. Please make sure you take care of yourself and participate in a way that ensures your comfort. The 4 questions that we're really asking is, what does equity mean to you? What are your experiences with health inequities and how have they affected you? How can healthcare professionals improve so that they are providing fair healthcare? And is there anything else you would like us to take in consideration? And with that, Dan, I'll hand it over to you. Please raise your hand if you'd like to speak. And I am still here, but I will turn off my camera because it's not about me.
Thank you, Ashley. Right now, folks, we just have one person with their hands raised, and that's Mandy Slatke. So Mandy, go right ahead.
Hi, thanks, and thank you all for being here. So yeah, my name is Mandy Slatke. I'm an advanced practice nurse specialist in substance use disorders and overdose prevention at Public Health Seattle and King County. I did provide a comment in a previous session, but I wanted to speak again about health inequities in stigmatized patient populations. I just have a couple more points I wanted to add. So specifically, I want to talk about people with substance use disorders, but first I want to acknowledge that there are other very stigmatized groups that also experience health inequities. So, you know, like people who are engaged in sex work, those with mental health conditions, people who are fat, and that those identities also intersect with other marginalized and stigmatized identities that, that compound inequities. So just talking about stigma as an overarching topic that is so important to healthcare. We know that there's extensive research that shows that stigma leads to social isolation, poor quality of life, less access to healthcare, delayed diagnoses, reduced treatment adherence, and physical and mental illness and death ultimately. And although addiction or substance use disorders is a health condition, healthcare professionals too often view drug use and addiction as something to be punished. And I've seen my patients go through this countless times, and had to, help them kind of navigate getting care that was compassionate and appropriate, and good quality care simply because of this health condition that they have. And it really leads to these extreme health inequities and barriers to care for these patients. So moving away from stigma and punishment to a public health approach and to compassionate care is not only more effective, but it's more equitable. Additionally, real quick, there's also research out of UW at some of the nursing faculty, specifically Ira Kantowitz-Gordon, demonstrated that not only does stigma correlate with patients receiving less compassionate care, but it also correlates with lower work satisfaction for nurses. So amid this nurse staffing crisis that we have, and we've been having, we really have to do everything we can to increase work satisfaction. And that includes better understanding our patients, better understanding people with substance use disorders, and reducing stigma in general. So to wrap up, and thank you for listening to me, as healthcare professionals, we really have a responsibility to change the way that we treat stigmatized patient populations in order to improve our patients' health outcomes. And DOH really has both the privilege and the responsibility, I think, to lead this paradigm shift by requiring healthcare professionals to learn about the impact of stigma in the health equity training. Thank you so much.
Thank you, Mandy. All right, so we got Troy next. Troy, you're all set.
Okay, can you hear me? Okay.
Yep, loud and clear.
Hi, so my name is Troy Seibert. I actually work at Public Health Seattle in King County on the overdose prevention and response team. But many years before, joining public health, I was just a person like so many folks who are struggling now with opioid addiction, and needed to seek services or seek help at a very critical time in my life. And so when I think about equity and what that means to me in the healthcare system, I think it's really important, as Mandy said, to talk about compassion. And my experience really was wrought through going to the emergency department, seeking help for withdrawal symptoms at the time, and running into a very startling experience. It was my first time actually seeking out help in the year that I had been struggling. And so to walk into a place where you expect, compassion for your medical emergency, and to really get greeted with, oh, you're one of those, you can sit, take a seat, and we'll get to you when we have some time. Which, by the way, could be 5 or 6 or 7 hours. It's your choice to stay or not. Was really an eye-opening experience that immediately discouraged what was a really challenging and a horrific time for me. Just the fear of reaching out, knowing that I was in a position where my options were very, very limited at the time. And so, and then to sit there and, in the emergency room and basically be ignored. And then when going to approach for a status update on time, and to hear that I really was told almost verbatim that I was not important to them and not a priority. That was a very, very difficult experience to go through. And so, to piggyback on what Mandy said, that compassion, especially at that initial contact point, is really, really critical for folks who are struggling with substance use disorder, opioid use disorder, in particular, who are seeking services and help. And so I think, training on anti-stigma, is really still a critical piece for healthcare professionals in terms of providing fair and equitable health, understanding where their clients or their patients, I should say, are at when they walk into the healthcare system, when they engage in the healthcare system is really important to meet those folks where they are at, and to realize that that there's a lot of courage that has to happen for that person to try to seek help, to step forward and out of the shadows and into the healthcare system, even if it may be their second, third, or fourth time doing that, but especially if it's their first. So I appreciate you guys for listening, and that is what I have to contribute. Thank you.
Thank you so much, Troy. Do we have anybody else? We don't have anybody's hand up. Anybody else would like to share?
We can always sit here if people need, time or would like to. This time is yours. And I just know I'm still here. I'm just taking a deep listen.
Hi there. Um, I'm going to butcher the name, so I apologize if I mispronounce anybody's name. It's M-A-I, so May Fay.
Yes, it's my fee.
My
May
Fee.
I is my first name.
Perfect. Thank you for being here. You're ready to go.
Yeah, sorry, I just joined the meeting late because I was accidentally in the Teams meeting. So I don't know what I missed, but I do see some questions up on the screen. What does equity mean to me? I think I'd like to just answer that for myself. I think what equity means to me is not equality. I think people confuse that. It does mean meeting people where they are. So, language differences could be an example. If you're a patient and English is not your first language, I think having the ability to access the information you need to make informed healthcare decisions in the language that you prefer is really important. And I can just speak from the other side of the table. I'm a healthcare provider myself, and I can tell you that it's very frustrating for me and the patient when they don't have the ability to understand everything that you need to convey, and you don't have the ability to understand everything that they need to ask. I don't have an English language issue when I am a patient because I am fortunate to have had English as my primary language. However, just as you demonstrated, because my name looks and sounds foreign to a lot of providers, I will be treated differently because they look at my name and they make assumptions based on whether or not I may be able to speak English fluently or not. So I have been treated negatively and differently. I can give you a concrete example. I was scheduled for a procedure in Vancouver, Washington, and my partner, who is a white male, attended with me and accompanied me to the procedure. And the medical assistant entered the waiting room and proceeded to look at my partner and ask my partner, how do you say her name? And ask my partner again, how do you say her name? And she was pointing to me. And I was sitting right there, right next to him. And he looked at me and her in disbelief because he knows that I can speak English just fine. And, you know, I said to her, I can say my name just fine. And I pronounced my name for her. And I repeated that. I can say my name just fine. You can just ask me. And I think at that point, she knew that she had made a mistake in assuming that I could not speak English based on my name. So I just wanted to say that that was an adverse experience for me. I had never been to this provider before, but their medical assistant and potentially the front office people made such a negative experience for me that I started off on the wrong foot for that procedure.
Thank you so much for sharing. Anybody else want to share? Just hit that raise hand button. All right, next we have Cynthia.
Hi there, can you hear me?
Yep, loud and clear.
Perfect. So my name is Cynthia. They know me by Cindy Cantu. I am a community health worker for a couple of counties here. And I just kind of wanted to piggyback on that. You know, I totally agree as far as stigma. I had a similar experience several years ago. I actually managed family practices and specialties for many years. And I myself recall getting really sick with flu-like symptoms one year. And I went to an emergency room at the local hospital. And when I arrived, I was, you know, of course, feeling very, very ill. I had a ponytail and sweatpants on, and I am a Latina. And so, you know, I get that, you know, I myself get that, where they'll start speaking to me in Spanish, assuming that I don't know English. But that wasn't the real, I think the disturbing part for me was I arrived and I wasn't treated very fairly. I could feel, you know, uncomfortableness with the nurses, just kind of like, what do you need? You know, why are you here? And just really picked up on those feelings. And then a nurse that I knew walked in after an hour or so and said, hey, how's it going? Blah, blah, blah. And another nurse that had been helping me was in the same room and happened to mention my position and where what office I managed. And it was like night and day. The treatment, the tone of voice, the body language. And so that to me was very disappointing. And actually I was on a team and I brought it up, not necessarily pinpointing certain people, but I did address that situation. It's very important that no matter, you know, we have all these inequities and like mentioned before in different areas, but it was just an appearance. And so that I have always had very good mentors, and I've shared that with staff and employees that I have supervised, the importance of really treating people with respect and kindness, and really acknowledging them their needs. They're just as important as anyone else that walks in, no matter what your status is. And so I just kind of wanted to share that because that really hit at home for me.
Thank you so much for sharing. Next, we have Elizabeth Piang.
Okay, can you hear me now?
Yep.
Okay, yeah, I wanted to just share my sentiments of someone that grew up here in the US as a refugee and being the voice of the Southeast Asian community to be their interpreter for when they go and get services. One of the things that I realize as a professional now, I reflect back on the uncompassionate attitude when refugees, immigrants, and anyone that didn't grow up here and to try to get services. There is no dignity behind that, and especially if you don't know how to navigate the system, that's the inequity, my experience that I'm sharing with you all. And we have to revamp the system, whether it's to have bedside manners, or look at it from a lens on. I'm a social worker, so I'm always going to look at patient care from the appropriate lens and have it culturally relevant, because there are many cultures that we navigate through as professionals. We help individuals. So it is so important that we continue to find ways to continue to meet our clients and our patients where they are. And if it's culturally relevant, that's wonderful. Use all the tools that you have in your tool bag, the appropriate ones. But be mindful that we still have to we have to come from a compassionate perspective. But yeah, that's what I wanted to share. Thank you.
Thank you so much for sharing. Anybody else like to share?
Dan, I see some hands raised.
Yep, getting them right now. Sorry about that. I was checking out another quick screen. Nicole Hood, you are up.
Yes, all the things that have been shared resonate with me. My name obviously sounds pretty white bread American, but I am biracial, and my experience in life has been to be treated as other, not to be treated as white. So I never know when I'm with my mom, and especially when I was growing up, when I'm with my mom, I would be treated differently than when I was with my dad, who is my white parent. And now as an adult navigating the world with a child who appears white, I've had my own experiences in the healthcare system where I have learned that it's best not to provide my race and ethnicity information on intake paperwork. And my most recent visit to a new primary care provider, I was having to argue with the front desk person about why I'm choosing not to share this information. And then when the nurse or medical assistant was taking my vital signs, I don't know why. It was at the end of the day. There could have been a million reasons why she was so rude to me, but it was freezing cold in this office, and she put the sensor on my fingertip to try to get my pulse ox or my blood pressure, but she was holding on to it, so it wasn't grasping my finger properly. And she said she wasn't getting a good reading, and she said, "Are you cold?" And I was like, "Yeah, it's freezing in here," trying to be lighthearted, because part of the burden on me in a medical setting is to be agreeable as possible, no matter how horrible I'm feeling, so that I'm not treated badly. When I made the little joke of, "Yeah, it's freezing here in here," she ripped the sensor off my hand and dug her fingernails into my wrist as she was squeezing to then take my pulse that way. So that was my personal experience. I nearly actually left and never went back to that provider again because of how badly I was treated by the initial person that I saw. But the provider herself was a lot more caring and compassionate. I have good insurance. I have a name that is very, acceptable by white American culture, and I still have these experiences. Another one was in 2019, my son had some health problems related to a congenital issue that we hadn't known about. So he was in the hospital and had several emergency surgeries. And after one of them, I was told to go wait in this room. The doctor will come and tell you how the surgery went in just a few minutes. Then you'll be able to see your son. And I waited for over 10 minutes, and this hadn't been the case with any of his other surgeries. And I started to get worried and I started to cry. Obviously, this is a stressful situation. And I was by myself. I didn't have anyone supporting me through the emotions of my child going through so many surgeries. And finally, a nurse walked by and choked through my tears to ask her, "Can I find out what's going on with my son?" And she's like, "Why are you crying? Don't be like that. Just because you haven't heard anything doesn't mean anything bad is happening." Absolutely zero compassion for what I might be going through. Even, "Do you need a minute? Well, I'll find out what's going on." Again, I don't know what happened earlier in her day, but this is her job. And I'm sure she sees parents who are upset a lot when their children are going through difficult things. So I just wanted to share that. I can never pinpoint exactly if it's because I'm not white, but it always feels like, what other reason could there be?
Thank you, Nicole, so much for sharing. Next, we have Chanel Brown.
Hello, everyone. My name is Chanel Brown, and I am a public health nurse. I am a home visitor nurse in Pierce County, and I work to provide home visits to Black or African American women expecting their first child. And so what equity means to me is true access to resources for all. No politics, no barriers, just true access to resources. As a Black woman, I have had negative experiences with healthcare in the past. A few years ago, I was turned away from a local ER once, and I was going to be turned away twice if I didn't have the courage to advocate for myself and push the doctor to do some tests. And it turned out the medical issue I was having was a blood clot, in my brain. So imagine what would have happened if I just followed what the doctor said and went home. I often reflect back and wonder if my race or my age played a part in being dismissed and my opinion not being valued. And then now, as I do my work and provide home visits, I realize that it could have been both, but I'm leaning toward the race side due to my journey with my clients and experiencing the secondhand trauma from their experiences and having to take this difficult journey with them. I have learned and I have experienced that BIPOC folks are often unheard and dismissed. And the program I work for, which works to eliminate those barriers and promote health equity is often underfunded and has been underfunded for years compared to other programs. And it seems like no one understands how harmful that is. And our families in the program continue to struggle due to the lack of resources available to them. And that often makes it very difficult to do my job. And I often spend my days feeling defeated and frustrated. My clients are not being educated on pregnancy like they should from their providers, and their questions aren't being seen as valuable, and they are constantly dismissed. And I have to always remind my clients to advocate for themselves and give them the Black birthing rights to make sure that they know the authority they have as patients. And with the recent news of maternal mortality rates increasing despite increased awareness, shows me that society is focused on politics and checking the box rather than truly helping our women and children and everyone else in our community. And I continuously work on pushing for health equity, and I appreciate DOH for hosting this listening session, but I want you all to truly listen to what everyone is saying and remember these thoughts and opinions everyone is bringing up on future opportunities to provide funding or other implementations for Washington State come up.
Thank you, Chanel. Next, we have Nicole Hood.
I'm sorry, I already spoke. I
Oh,
thought I lowered my
that's
hand.
right.
I'm sorry.
Oh, no worries, no worries. Sorry about that. I thought so too, but I didn't know if you had another comment. Sorry.
I might have bumped it.
Got it. No worries at all. Thank you so much for being here. Anybody else? Anybody else like to share?
Hi, this is Mai Fee again.
Hi.
Hi, I have just another episode of inequity that I experienced. This one occurred, actually, it wasn't in the state of Washington, it was in Portland, Oregon. I live right across the border, so I receive a good portion of my health care in Oregon. And I was at a large medical facility. I had great insurance provided through my employer. However, because the name of my insurance company was uncannily similar to the name of the Oregon Health Plan insurance at the time, I was treated poorly. I basically provided all of my insurance information before the appointment, and when I arrived to my appointment, I was told that I would need to immediately pay $300 as a deposit for the appointment visit. And I explained to the front desk that I was a full-time employee with employer-provided insurance, And this was not the state Medicaid program insurance, even though the name of it was similar. And I just felt really humiliated that they thought that I didn't have any insurance, and I would therefore need to be a self-pay patient. So I had several follow-up phone calls with the billing department of that hospital and got things straightened out, but it was very stressful, and it felt to me like I was treated as someone who may benefit from services and not pay. So they forced me to pay ahead of time. That payment was applied toward my costs for the visit once my insurance actually processed. But I went back to the Human Resources Department at my employer and explained what had happened to me. And I also made a complaint, a formal complaint with that hospital's billing department as well. But I don't really think that the issue was resolved, because I think it was just an interpretation made, a snap judgment made by the front desk or the billing department that said, this person is uninsured, beware, make sure that you get payment ahead of time. And it felt like I was less than. And that's what I wanted to share about that incident.
Thank you so much. Elizabeth? Oh, sorry, my fault.
Okay. Another thing came up, and it's speaking of two things I'm thinking about: advocacy and intersectionality. So I had a situation accessing the behavioral health system for my son, and this is in another state. So, and the advocacy part is I have been told that I was too aggressive in advocating for my child. And this is another social worker telling me this. So you're either viewed as you know too much and we're going to challenge your knowledge, your experience, and we're not going to recognize you as anything other than a minority or an Asian woman, because obviously my name is not a Caucasian name. And my child was also biracial. So I do firmly believe that if I wasn't Asian or I wasn't a woman and I had a parallel knowledge of someone who is in the medical field, and I'm advocating for myself, I'm advocating for my family, I'm advocating for my son, I wouldn't be viewed that way. And that was the negative experience at the behavioral health and mental health system. So it just goes beyond primary care. It seems like it's saturated in all specialty areas. So I don't know what the answer is. I'm just sharing experience that it has to be revamped. How? I don't know. But it was very concerning that I wasn't taken seriously as a professional that knew what I was talking about. We could have a conversation for planning, but if the first thing that you bring up is the fact that I'm overly aggressive in advocating for my family, we were taught to do that. Okay, we have a much more disadvantage when we are advocating for our clients, our children, our families, our loved ones. But that's the inequity there. Yeah, so thank you.
Thank you so much. Nicole, you're up.
Yes, I did raise my hand on purpose this time. So in what I shared earlier, I spoke about how I have good insurance and I was treated badly, so it wasn't the insurance reason. But I think equity also needs to mean that if people don't have insurance or have the state funded health coverage, they also need to be treated well. We're all human beings, and a human being who is in pain or suffering with a medical condition needs to receive care, not just medical treatment, get out the door, but to be cared for. That's an important part of healing. And I actually have had times in my life where I didn't have good insurance. And I knew from having had bad experiences before that I was not going to go into any medical establishment unless there was a dire emergency, because I didn't want to be treated badly on top of feeling badly physically.
Thank you for sharing. Next, we have Tiber.
Hello, thank you. So I was not originally planning on sharing anything, so now I'm nervous. So I'm hearing a lot of really awesome things, specifically dealing with racial gatekeeping, which is fantastic, in that it's horrible, but it's nice to hear represented. So I wanted to bring up something else. I am a nurse and a transgender individual, and I've been denied appropriate healthcare measures and appropriate testing from uninformed gatekeeping providers, like a lot of other people have shared about, you know, specifically many medical assistants, because they're really the first gatekeepers that we see that can deny us the care that we need, or even discourage us from asking for the care that we need because we don't feel empowered to do so. And for one example, I've been denied donating blood despite having a really fantastic blood type, and been sent inappropriate letters from blood companies because they don't understand that when you fill out a form saying that you've donated previously under a different name and gender, and now you're doing it under, you know, you're assigned your embodied gender and name, and they don't understand the problem with that. So they have denied my blood after, you know, a very lengthy, irritating, and invasive interrogation process that you have to go through as a person donating blood, specifically somebody who is either queer or transgender or something like somebody with a history of drug use, you know, speaking to stigma, like I've experienced all of that. And additionally, I've had issues filling out medical forms because the only options are binary. And sometimes that's fine because I do identify as a binary individual. But many people and many patients that I've worked with do not, and they have a hard time because you know, these forms have a reason, and one of those is to introduce the conversations that somebody might be seeking care for. So I was not able to get the COVID vaccine without having to out myself as a transgender individual, because you know, we're collecting that information, how the vaccine is affecting people based on birth gender, which is not, I get the point, but ultimately it's for statistics, and statistics are kind of crap anyway. I've experienced lots of transphobia and homophobia working in healthcare as a healthcare individual, as a stealth individual working in healthcare in this state. And I have had people assert that it is necessary to have surgeries and have X, Y, and Z procedures in order to qualify as somebody who's transgender. I, as a nurse, for a period of time during this pandemic, I did COVID-19 vaccinating, and I advocated for, I was really excited to work with HealthPoint, the FQHC, and then I discovered that I had to advocate for individuals who were transgender, who were trying to get vaccines, or even people who are not, people who were just read as whatever gender. They were not given pregnancy questions based on the gender that they were presenting, or various other questions related that people associate with being related to gender. They were not given that information. They were not asked those questions. They were just sort of left without. And that happens all the time in healthcare. It's not just COVID-19 vaccinating, but that's the thing that came to mind. Also, I am a member of several transgender support groups simply because I've gone to enough of the support groups and heard about mistreatment and inappropriate treatment and people who don't know how to advocate for themselves and don't know the treatment that they should be provided. And WPATH standards for this are what people should be consulting, but that it's such a I'll say like a grassroots. It's such a poorly known concept, which is silly because there are so many transgender individuals in the United States, that it's just a constant issue. And I hear things that are wildly inappropriate all the time. So I would like to see, especially from a public health, as somebody said earlier, responsibility and privilege, that sort of a thing is a little bit pushed a little bit further into the prominent eye of things that need to be addressed. Thank you.
Thank you for sharing. Next, we have Gifty.
Hi.
Hi there.
So my experience with I'm an African who migrated here. So it's been about 10 years now, and when I moved, I was having difficulty with, though we do speak English from where I am from, I still was having difficulty understanding people and essentially expressing myself as well, because I have an accent. And I remember for quite a bit of time, I was having some health issues, and I had to go to different providers to kind of figure out what was going on. And most of those providers that I ended up going to see, I didn't know if it had to do with my accent or these were essentially like white providers. So they could not figure out what was going on with me. And this had to do with, I actually later on found out that I had a cyst. And that was after like 3 or 4 years of being in pain and going back and forth. And the last doctor that I ended up seeing, who was African American, actually referred me to go get a scan done. And when I got the scan done, that was when it was found out that I actually had an ovarian cyst, which was so huge that needed to be taken out immediately. So later on, I sat and then I was kind of going over my experience, and I asked myself, what if I had met this doctor earlier on when I was having my symptoms, and he would have helped me figure out this instead of me going through all that years of pain and not being able to find the right treatment. Yeah, so that is my little experience. Thank you.
Thank you so much for sharing.
Mm-hmm.
Thank you. And if you have additional comments, questions, maybe want something to be considered, please don't hesitate to email us at healthequityimplementation@doh.wa.gov. I have been putting the email address in the chat, and hopefully it reaches everyone who has something to say. At this time, I'll hand it over to either Ross or Hope to kind of share about the next steps. And then I'll take it back at this when they're complete.
Thank you, Ashley. This is Hope. I'll take over the next steps for this one. So thank you, everyone, for joining us and those who shared. This is the final listening session. So again, thank you to everyone who participated. We appreciate your invested time and care in this project. Next comes the rules workshops. Those will allow us to go through rule draft language with everyone. Everyone will be able to ask questions, make suggestions, and we'll work through the rule language together. There will be 3 workshops. Right now, the dates are Monday, March 7th at 2 p.m., Monday, March 21st at 1 p.m., and Monday, April 4th at 1 p.m. Gov delivery notices for those will be sent out next week, I believe. After the workshops, we'll speak with boards and commissions to get their feedback. We hope to file our notice of proposed rulemaking, which will include the proposed rule language in July. Then the public hearing for the rule language will be in September, and this will provide another opportunity for public feedback about the proposed rules. And then once the rules hearing is complete, we'll wrap up the process with the rulemaking order and finish the rules by the end of the year. And with that, I will hand it back to you, Ashley.
Thank you for sharing more on that. I really appreciate the participation over the last 4 listening sessions. I've learned a lot, and I have shared a lot of the pain that was expressed, celebrated the suggestions for improvement, and overall, I very much appreciate you. Some of the questions that were asked is there another way to submit comments or answer the questions? You do have some options, and one of the easiest options is just sending us an email. It's very limited on who can see it, although we won't be able to ensure your anonymity. We can answer those in private, and we will review the comments. Also, I will make sure to put the future meeting dates in the chat. The format will be a little different, so everyone during the rulemaking process will be able to see each other. And once again, you can participate in that process in the level that makes you the most comfortable. With that, I really appreciate your participation, and hopefully you have a nice day, and I will put the dates in the chat. Thank you.